the lifestyle interventions actually the very difficult thing. We know that we can give the recommendations, we can give everything, but it's very difficult to mend our lifestyle. So what if think actually this is lifestyle? I will go in short. So lifestyle is defined as the personal customs or habits of an individual or group of individuals. So whenever we are talking about lifestyle, we know we are talking about dietary habits, physical activity, substance use, tobacco use, or any other risky behaviors, either that is device addictions, increase screen time, or any other irregular diet, irregular timing, and everything, irregular sleep also. So it actually combines everything which actually forward us to the risky behaviors and leading to an event or disease. So there is not a single universal accepted definition of chronic disease, we know, and lifestyle disease are a group of diseases and that share the common risk factors such as unhealthy dietary choices or any addiction or use or inadequate physical exercise or sedentary behavior or stress. So one that lasts a year or more requires ongoing medical attention, and it is the or limits the activities of daily living. So we are talking about the domains of lifestyle modification, and also we can add the air pollution in it. So the potential of lifestyle changes is that the several lines of evidence indicate that the realistic modification of the diet and lifestyle can prevent the most of the coronary artery disease, stroke, diabetes, cancers, and other smoking-related cancers. So we can it is very much true that elimination of these modifiable risk factors would prevent the 80% of premature heart disease, 80% of premature stroke, 80% of type 2 diabetes, and 40% of cancer. My previous speaker also said that. And impacts of lifestyle modifications are many. I can't describe it all, but at a glance, we can see that we can reduce all type of diseases, including CVD, type 2 cancer, metabolic syndrome, depression, everything. So what are actually the challenges of lifestyle changes that we should focus as a whole at the end? That we are, challenge one is barriers to government intervention or action. And the challenge two is barriers to behavior change, and then challenge three is barriers to education and barriers to healthy lifestyle programs. We know we are from the low and middle income countries. We have many barriers, but we need to address these barriers to overcome all the prevention strategies that we already discussed about. So what is the barriers to government intervention? That we know in our countries, the government is changing frequently, and one government is not giving the importance to the strategy to implemented by other governments in most of the cases, and always the strategies implementation remain incomplete. And also the public perception, we know that government is forcing us to do anything and or hampering our human rights, and some group of powerful lobbying groups are there on the government pressuring to do the things that are not in the according to the policy. So also the barriers to the behavior change, we know that at the individual level or also in the family level or the personal level, we know that this is the most difficult thing to change our behavior, and also our lack of resources also don't give us the opportunity to change ourselves in a more easier way. And the barriers to education, as a low and in middle income countries, we know we have lack of health literacy or dissemination of information, and we also have disparity in gender, racial, and ethnic minorities. And we know that the awareness of unhealthy lifestyle risk factors are very much low among the population, and also the lacking the preventive strategies for this. And the barriers to healthy lifestyle program, also we know we have lack of health care resources. We know we have lack of physicians, but for the lifestyle interventions, we don't only need the healthcare providers like physicians, we also need the health educators and other logistics that we have limitation, and we have poor physician referral, low patient enrollment also, and we lack of public health educators and lot of alternatives in the service delivery system of health. So to overcome these, we need a proper messaging and well-formulated campaign strategy, multi-party political structure, and multi-coordination system that we don't actually have, and also the professional community organizations with a long-term interest for prevention of these diseases, not only for thinking about the curable treatment. And also we need to effort to educate the women who are the basis of a family and the key decision makers, and who actually can prevent the NCDs or mend the behavior of the children at the family level. And there should be emphasis on efforts to increase community participation that we don't have. The community participation system in the delivery system, we should include that. Now, the recommended lifestyle changes, all have described their recommended lifestyle changes, but we need to recommend to avoid the tobacco use, eat a healthy diet, and maintain daily physical activity, and avoid harmful use of alcohol as a whole. I will not go for the whole prevention method, but for tobacco control, we know we have the WHO Framework Convention on Tobacco Control, and which has actually two measures. Main two measures are measure one is to reduce the demand for tobacco on price and tax measures and non-price measures. And measure two is to reduce the supply for tobacco, maintain the supply chain in the production, distribution, availability, and supply. We know we have empowered, but we have the policy, we have the tobacco control law, but we don't have the implementation that we need. And by controlling tobacco, we can protect people, and we can prevent at least 40% of all type of cancers. We know that. So we need to ratify this WHO FCTC control system and need the implementation. Also, we need to emphasize on the quitting tobacco. Those who want to quit the tobacco, we need to help them as a public health professional, and also the healthcare providers, that is non-medical staff, should come forward in the 5-step action for quitting tobacco. And we should inform the people that there are many health benefits of the quitting tobacco, and there are immediate and long-term benefits that we can get. And there are also the age benefit. At least at any age, if you want to quit the tobacco, you will get your benefits. And also quitting smoking decreases the access risk of many diseases. We should inform the people about this. And not the least, actually, that the legislation and enforcement, and this is we need in all institutions and in all mechanisms, in public education, advertising, promotion and sponsorship, price and tax measures, secondhand smoke and tobacco product regulations. We know that we have graphical warning in the cigarette packets in many of the countries under WHO, but we are not controlling the smokeless tobacco use that is more common among the women. And also the initiation during of the smokeless tobacco use is found mainly during the pregnancy in the low-income countries. And also we need to educate them that this smokeless tobacco is actually similar to if we take the smoking. As a healthcare professional, then we can be a role model for all of them. We can advise on cessation on a regular basis. We can make own premises and events smoke-free, and we can influence the health education institution to include tobacco control in the curriculum. That is also lacking in the curriculum of the primary and secondary educational board. And we can prohibit the sale and promotion of tobacco on our educational institutes in the hospital settings also, and we can support the smoke-free places. Now, about the healthy diet choice, all of the previous speakers have mentioned very well. We want to know that the healthy diet is essential for good health and nutrition. and a healthy diet that helps to protect against the malnutrition in all its forms, as well as our NCDs, and which actually depends on our individual needs, cultural context, locally available foods, and dietary concepts. I'm going short that the dietary practices we need, that is as a whole for all people, not only for women or only for children, but we need to take less than 30% of the total energy intake from fat. We should prefer the unsaturated fat over all other fats. And we need to move towards the elimination of the industrial trans fat, and that is available in different bakery items, and also the uh, oil, that is palm oil, dalda, or any other unsaturated fat, and trans fat should less than 1% of the total energy intake. And like anything, we need to limit the intake of free sugars to less than 10% of the total energy intake. That is at 12 tablespoons in a day of a person who is taking the 2000 calories per day. And we need to limit our salt intake less than 5 grams. That will lead to us to control our blood pressure. And we need to eat plenty of fruits, vegetables, legumes, that all the speakers already told, and that should be 5 serving, at least 5 serving fruits and vegetables per day. And we should know what is the healthy and what is not healthy. And regarding infant, we should that the infant should be breastfed exclusively for first 6 months, and then 2 years, or up to 2 years. And from 6 months age, breast milk should be complemented with a variety of adequate, safe, and nutrient dense complementary foods. And salt and sugar should not be added to the complementary foods. And the children in their growing period, from the very beginning of their life, should avoid the salt and sugar, or use extra salt or extra sugars in anything, or drinks, milk, on everything. That should be our choice. And the key facts is high salt consumption and insufficient potassium intake contribute to high blood pressure. And we know that the salt is readily available in all the salty snacks, chips, and everything, or fast food, that actually the children are accustomed, or children are having their habit from the very beginning. So we should limit that, and we should be the women can do that more appropriately in their family during the cooking process, or during the meal preparation. And they should not having avoid the habit of adding salt, and table salt should be prohibited on the table, and in the limiting the consumption of salty snacks. And we can reformulate the recipes, and they can do the women or the mothers can do anything like this, the check food labeling, and having a practice of it. We know that we don't have the practice to check the food levels at the marketplaces, so that can be done. And the food authority also should make good food labelings that can be recognizable from the very front. Now, physical activity, we know that any type of physical activity is preferable. This is not only the physical activity of a different choice, but we can have work-related physical activity, we can have exercise, we can have sports. Everything is physical activity, that is the movement of the body at any type. Physical activity, regarding physical activity, we know that 80% of the adolescents and 27% of the adults are currently physically inactive, and that's the most important thing the whole world is actually marking. So 1 in 4 adults do not meet the WHO's recommended levels of physical activity, and physical activity levels in adults is lowest in Southeast Asian region. So we know that 5 to 17 years children need up to 60 minutes of moderate to vigorous intensity physical activity daily. And in this, we can have the awareness development of the parents and among the teachers and in the school going children, because unless the children will not have the habit of physical activity, and will lead to the adult type of NCDs, and also in the For adult 18 to 64 years and also beyond 64 years, we need the 150 minutes moderate intensity aerobic physical activity or 75 minutes vigorous intensity physical activity. But this is the minimum requirement, and we can skip that. But it is we will get the more additional health benefits if we do the moderate intensity aerobic physical activity up to 300 minutes per week, and
Ma'am,
also
please
the
wrap
muscle
up. Please
strengthening
wrap up,
activity.
ma'am. Please hurry up.
Oh, yes, yes. And so this is the global action plan that we need, that more active people for a healthier world, and 10% relative reduction in prevalence of the insufficient physical activity. And this I want to mention about the 4 strategic objectives that create an active society, create active environments, create active people, and create active systems. By 20 policies and actions in total, we should go for this physical activity implementation by these 4 strategic objectives. And now there's only one thing, that's about alcohol intake. So we can actually regulate the strategies to reduce the burden for alcohol by regulation of the marketing of the alcohol beverage, regulating and restricting availability of alcohol, and so on. So this is the actually main thing, that intervention of lifestyle modification. We should have the educational interventions at the school-based program, and also workplace intervention and intervention by the healthcare providers at their during practice, and also in the hospital level there should be separate educator. And we should have the transportation policy and environmental design to limit the role of automobiles, and decrease the sounds and the air pollution, and promote walking and bicycle riding, and design cities and towns to promote health. And we need the improved food supply at the improving processing and manufacturing, fortifying food, increasing the availability and reducing the cost of healthy food, and also promoting healthy food choices and limiting aggressive marketing to children. And we need the most effective the interventions like at the community level, and community-based interventions, and the policies, not only for making the policy, also the implementation strategy for these policies. And thank you all for your patience
Yes.
sharing.